We are the Pennsylvania Manufacturers Association.
We are the Pennsylvania Manufacturers Association.
Business in Pennsylvania.
And business in Pennsylvania is our business.
There are questions about whether or not you're softening your stance on the medical marijuana issue. An aide recently said if the FDA says it has merit, you'd reconsider your opposition to it. Is that are you softening at all on that? We've talked about this issue before.
Define for me what medical marijuana is.
Medical marijuana prescribed specifically for medical reasons, a form of marijuana that's not necessarily the kind we had Senator Mike Fulmer.
Now you see how long it's taken you
I do, but we had Senator
that?
Mike Fulmer in our studio last week, and he was describing this to me, and he said, if hippies think they're going to get their hands on medical marijuana and get high, there's going to be a lot of disappointed hippies out there, because it's not that kind of marijuana. But is it true? I mean, you've always said no across the board to this, but if the FDA comes in and says it has merit, would you
But
would you
if the
consider
FDA has done the testing, the clinical testings to see that it actually works, there have been no tests to see that works under the FDA. And that is the agency of the federal government that makes the determination of any drug that you take, any prescriptive drug that you take, whether it works and meets the criteria to be able to be sold in that method. Now, there's a state senator that wants to legalize the use of marijuana for medical marijuana and everything else, but he wants to use it, frankly, for recreational. There's no way recreational.
Senator Dalen Leach.
Yeah. There's no way recreational marijuana will happen in Pennsylvania.
But Senator Mike Fulmer on the Republican side now is also pushing for this.
Not for recreational.
Not for recreational, no, but for medical.
But when I read the media, it gets all kind of confused, and there's a big buzz. The one that has been talked about is Charlotte's Web. It's the oil. And what I have said is if the FDA does the test and they say yes, well, then that's a different story. But nobody has done that. And the reporting that I've softened my stand, I've always been with FDA does the test. So now, did I soften my position?
So no change in your position
Not really.
is the answer to
Not
that
really.
question.
More maybe a clarification because I've been asked the question.